This guest grew up in Dutch Quarter, went to Oranje School, then VWO at the Milton College. After MPC, she went on to study in Amsterdam, the Netherlands, in dentistry. She returned home and now runs her own dental clinic in DQ. Today, ProSXMity is proud to welcome Dr. Leonie Bryson. Welcome.
Good morning. Thank you for having me, and it's a pleasure to be here.
Before we get into it, when did you return to Sint Maarten and when did you open your dental clinic?
I returned in 2017. Fun fact, 2 weeks before Irma. So maybe I was like the bad luck charm. I came back on the 20th of August, and then 2 weeks later we had Irma. 4 years after, July 15 of 2021, if I'm saying that correctly. Yeah.
For those of you that don't know, being in the healthcare field runs in the vein of Dr. Bryson. She is the daughter of a well-known, respected doctor here in the Quarter, Dr. Bryson, who had a general practitioner's office for many years. And her first job was actually running a snack stand at his clinic. When did you realize that you might also want to go into the medical field and specifically dentistry?
I had a procedure done in my exam year. My wisdom teeth were growing. They were not growing in the correct manner. And I had a procedure done. I went to Marigo on the front side, Dr. Bonet, for those that can recall. I had 4 wisdom teeth extracted at the same time.
Wow.
And I had, I think, just about a month after, we had orientation and we had to make our choice on what we wanted to study. Medicine is in my family, so I am quite at home within the medical field. With giving my initial choices, I was like, okay, I had so much pain in removing these teeth. I was so happy that I got relief. I was like, maybe this is something that I could do for someone else. So I made a choice. My 3 choices were a house doctor, or a dentist, or a midwife. So those were my choices that I put. And back in that time, we didn't have, I wouldn't say the free choice of making which choice or what we wanted to study, but we had Minister Plaatsen. So if you made a choice of what you wanted to study, it would go into like a pool. And according to what was available at the time, you would probably get like a selection. So the top 3 choices, those were the ones that you gave. And it would have been like a kind of Russian roulette, see what comes out of it. And in my year, I was fortunate enough to get the ministerial place for dentistry. So that's how it came about.
How does being a daughter of Sint Maarten and a healthcare professional shine through in how you lead your practice?
Being that the practice right now is located in Dutch Quarter, this is basically my backyard. So all of the patients are most of the time neighbors or people that I know from growing up since I was 4 years old, being here in Dutch Quarter myself. It plays to me a great role in knowing your community and also feeling comfortable in your surrounding. It's not so much so that you are the medical professional and they are the patient, but it's more of a connection. So you feel very connected to the people that you treat. I think it gives you also a greater sense of responsibility because it's not far from your bed. These people know you. They know where to find you. So it's for me, it's a little bit, I feel like it's my niche, my circle. These are the people that I treat. I do it with love. I do it with a lot of compassion. That makes it for me a very important thing that the work that I do has to be done to a caliber because it's not just patients. These are, I wouldn't say family, but it's just close to me. So it's important to know that the quality of work that you give is to the correct caliber.
What was the moment, the patient, or the story in your career that confirmed, yes, this is exactly what I was meant to do?
That's a good question. I wouldn't really say that I have anything that stands out at this point in time. I know it gives a really fulfilling feeling when someone comes to you with an issue or complaint and you were successful in making that person's or solving that person's problem. Once a patient leaves either in less pain or is just satisfied with the treatment, the smile is there. They feel better when they leave. I think that's the sense of fulfillment that I get out of it. but not a specific story or case that I can say, well, this was the marking moment for me.
How do you stay grounded in your purpose when days get long or tough?
Remembering the reason why you're doing it. My dad ran his practice in Dutch Quarter almost for 30 years. I was very, very avid on the fact that I wanted to come to Dutch Quarter. A lot of people see Dutch Quarter as probably a ghetto,
Yeah.
or, it's just not one of the leading districts of Sint Maarten, but I do think that we have a lot of potential.
Amen.
And I think that it was very imperative that I opened my practice here. On the days that I am seeing that it is too much and that I'm exhausted, I do put in the back of my head the reason why I am doing this. It is to give our community a place on the map. It's also for us to know that, we can also be in a leading sector like all the other districts, the Veneers, the Simpson Bay, Phillipsburg, doing the work, but also creating substance for Sint Maarten. It's important. So that is where I find my motivation and my drive. As a local, I do find it is very important for us to give our all for our own people. It does not have to always be somebody from outside. We can be here for our people.
What is one thing that no textbook ever taught you, but life taught you?
Some tough questions, Miss Barry. No textbook has taught me. I live by a quote in the Bible that you can do all things through God that strengthens you. Life has taught me that. If you keep yourself grounded, I am a Christian, have some faith, something that you hold fast to, that it gets you through. So for me, that is something that is very important, because some days you have to dig deep. So, if you have to dig deep, sometimes you have to find something that you can hold on to carry you through those days. So that is something that is really important to me.
We've reached to a segment of this episode I call the propeller questions. But today we're going to do the dentist edition.
Fun.
Yeah. So I'm going to ask you a few true or false questions and ask you to elaborate a little bit with your answer.
Okay.
True or false? Getting a cavity filled always hurts.
False. A tooth is basically built up of 3 layers, 3 segments. The top layer, so what you see in the mouth, the white part, is enamel. That is the hardest substance of the body. Harder than bone. A lot of people don't know that.
Fun fact.
The second layer is the dentine, so that's like the second part. So under the enamel you will find that, and the heart of the tooth, which is the nerve, is the pulp. If the cavity finds itself in the upper part, which is the enamel, that does not hurt. So technically you can drill in that part of the tooth without using anesthesia. However, 9 out of 10 times it is always surpassed that layer. So just to be on the safe side, so that you don't feel anything, most of the time we do use anesthesia, and in that way you're numb and then you don't have any feeling. But the anesthesia is administered with a needle, and that's the biggest gripe for most people. So yeah.
True or false? A manual toothbrush is always better than an electric toothbrush.
False. It has been scientifically proven that electrical toothbrushes brush better than manual toothbrushes. Case in point, a manual toothbrush is that, it's manual, so you have to do that. And if you are not making the correct motions, then you don't get to remove the plaque accordingly. The electrical toothbrush has a constant motion. It just moves a lot more of the plaque and tartar that is located in the mouth. However, both toothbrushes have different techniques. So you cannot brush your teeth the same way you do with a manual toothbrush as you do an electrical toothbrush.
Wow, I didn't know that. I thought the electric toothbrush is just doing the work for you that you would do with a manual. So you just keep it here and then keep it there and then...
Yeah, but that's the biggest problem or the biggest mistake that people make. They move an electrical toothbrush.
Ooh.
So if you are moving, so like if you're scrubbing your
Right.
teeth with a handheld toothbrush, you have to move, you have to make the movements. However, with an electrical toothbrush, you have to stay still. Because
Wow.
if you're moving and the brush is moving, it's equivalent to skipping like a rock over water. So it's just gonna be skipping over the surfaces and not really cleaning. So the techniques are vastly different.
True or false? You only need to visit the dentist if something hurts.
Absolutely false. Absolutely false. I don't know who needs to hear this, but say it loud for the ones in the back. To start with, full disclaimer, we ask you to come twice a year. The time frame in which we ask you to come, it plays a significant role in the decay process of teeth. The cavity doesn't go from a small hole to a major crater from one day to the other. The 6 months period time, it's more for us to be able to interject if there are problems. The rule of thumb is that you should see a dentist twice a year. That is for you to for us then to be able to have checks and balances in between the two sittings, so that if we do see something is starting, so cavity is starting or there's a crack in the tooth or anything is there, that we can get to it in time. The biggest problem is when you come to us only when there is pain. The problem is usually very big, and it's also most of the time quite expensive. So a filling can range anywhere from a couple of $80 to $100. Root canals can go a couple of hundreds of dollars to thousands of dollars if you have to fix a tooth. Getting to the problem before it gets out of hand, and then it's all around better for everybody involved.
True or false? Veneers are the modern dentures. And I realize that's a bit of a tricky, controversial topic. So maybe you could explain what are veneers actually, and very short, and why it's not a denture or it is.
Veneers are not the modern dentures, for the simple fact you need teeth in your mouth to be able to have veneers. So if you require dentures, veneers are really not an option, because you have no teeth in your mouth if you need dentures. However, veneers are a very trending topic at the moment. Everyone's into this Hollywood smile, and I can imagine with us living in a TikTok era, Instagram era, that everybody wants to present the best versions of themselves. However, to place veneers are basically caps or crowns. They are only surface level, so it's only what you see. So it's more for aesthetics. They are placed on the top surface of the tooth, and they are not really embedded with full retention to the tooth. And that is most of the time the biggest issue, because what tends to happen is over the course of time a veneer can come off, and that spoils the general aesthetic of the teeth. They do serve their purpose in different contents, but I think that is something too that is needed within the world of dentistry. I think we need to bring a lot of awareness to the different terms, terminologies, also the different kinds of treatments that we do. Because, you hear, oh, my neighbor got an implant, I want implant too.
Yeah.
It does not work that way.
No.
What is applicable for one is not applicable to the other. It's always good for you to be well informed when you make decisions to do any kind of medical procedures. Saying that again, be very well informed so that you know the pros and cons.
So, rounding off our conversation, a few closing questions. Today is your off day, and let's say after this, you have to go run errands. What's one genre of music that's standard in your playlist in your cap? Soca.
Live for soca.
Team Soca here. Team Soca is present.
Boy, it's something about being a West Indian that is never going to. No, it's Team Soca all the way. The upbeat music, it just gives a bit of a drive and motivation. So yes, hashtag Team Soca.
What's your favorite Sint Maarten dish?
Woo! My get my Sint Maarten card revoked here.
Yeah.
My favorite Sint Maarten dish. Can I say fish and fungi?
Of course, if that's what your favorite is.
That was if I get my Sint Maarten card revoked, because that might be more Antillean than anything else.
Doesn't matter.
Yeah.
Let me tell you something. If you get some fish that prepared the right way, it's a madness it could be. Okay. But how do you like your fish? Steam, fried,
boy? I would fry fish, boy.
Fried?
I would fry fish.
And you like it dry out, or you like it
No, it needs to have a little sauce on it. But some fish and fungi and a little okra or something on it.
But see, I know, you see now you lose me with okra. Because that year's going another direction. But I know there's an okra following that's very strong.
Yes, sir.
But I love a fish and fungi.
Yeah.
I actually sometimes like fish with green banana, provision.
Yeah.
So yeah, we both have a problem explaining our Sint Maarten card, but fish is fish. What's one piece of advice you'd offer a young person on Sint Maarten right now that's full of potential but unsure of their path?
My advice would be find yourself. If you know who you are, what you stand for, what you want, I think that is sometimes the easiest key in figuring out what you want. It is okay at times for you not to be certain, because that is what life is. It's a segment or a series of finding out or figuring out the next step. But if you have something that grounds you, whether it is your faith, belief, morals, ethics, something, you can always guide yourself between the pathways, because it's not always a straight road, but figuring out what you want also has to do with character. So friends tell you, hey, we going here, you could say, well, I'm going, but till this extent and not further. And it has to do with being true to yourself. So if you know, listen, these are the things that I stand for, these are the things that I don't stand for, this is what I want, or this is what I agree with and that I don't agree with, it will help kind of steer you through life, and also making sometimes the difficult decisions. Because I had options, you can do anything, but at the same time, in order for you to make that decision, you also have to know, this is what I want and this is what I don't want. So find yourself, and then most of the time, the answers will come.
Is there anything you would like to say closing off besides what we discussed today already?
I have a fun fact for you.
Uh-oh.
I don't know if you can recall, but I left to study in 05, 06, and we had some preparatory gatherings, meetings from out of the school. So Milton Peters did some, I think they called it the VOBAS at that time. So it was voorbereiding for tertiary education. And you spoke.
Whoa.
Yes.
You say 05, 06?
Yeah. You spoke. And you were just giving us some little snippets of your experience being in the Netherlands. It was quite comical. It stuck with me.
Like what?
I think you were taking a trip. It was a trip that was quite long. You were on a train, and you were saying, you were counting the cows, and it went from 1 to, and then it ended up to be 500, because the country is so vast, and it keeps you just busy when you're on the train. But however, it's something that stuck with me, because you were telling the story of how you had to integrate in being into the Netherlands. For me, it was something like, okay, I saw a young professional coming back home, and in my mind, I was nowhere near being a dentist at that point in time. However, it was just something like, this person did it, she's a local, she's a Sint Maartener, I can do it too.
Wow.
So at that time, like I said, I didn't even know I knew what I was going to study. However, it was just not solidified at that point in time. So it was inspirational seeing that you did it, knowing that somebody did it, that I could have probably done it too.
Wow. Well, thank you. It gave me a bit of goosebumps, because all these years later, that's exactly why I started this initiative, this ProSXMity. Because I think we always say the young people don't have a drive, or they don't have a focus, but it's a lot easier to get at if you can relate to the person that maybe did something, and it's like, well, wait, she's from here and she could do it, I could do it. And so it kind of, this is really awesome, because I completely did not remember all 20 years ago, but I'm glad that at least one person learned something and was inspired by it. So, Dr. Bryson, I want to thank you so much for being available to have our conversation today. And of course, ProSXMity wishes you and your clinic continued success.
Thank you. It was a pleasure being on the program. I look forward to seeing all of the other probably professionals, entrepreneurs, local entrepreneurs that you're going to have at your segment. I thank you for this initiative. I think it's very important that we have a platform where we can stimulate our young adults moving forward in their educational journey. I think it's important that at least that they have somewhere that they can find themselves, that they can have some, at least some good examples of what is possible, you know,
Yep.
because a lot of people think that, you know, you grew up in Dutch Quarter,
Yep.
that you can't do something for yourself, which is absolutely not true. So again, I thank you for being on the program, and I wish you also indeed all success with the initiative.
Thank you.